Duchenne muscle dystrophy. It's X-linked disease, and the most important sign in this disease is Gowar sign, which this means the patient climb himself while trying to stand up. If you look at this picture represents Gowar sign, okay? For investigation, the best investigation is muscle biopsy, while the initial test is creatinine kinase, okay? But the best is muscle biopsy. Now let's talk about very important topic, which is hemineglect syndrome and gerstmann syndrome. Hemineglect syndrome, it's occurred due to lesion in the right parietal lobe, non-dominant hemisphere. So if the patient is right-handed, the dominant hemisphere in this patient will be the left. So in case of hemineglect syndrome, it will hit the non-dominant hemisphere. So it will hit the right parietal lobe, okay, which is the non-dominant hemisphere. While in case of gerstmann syndrome, it's occurred due to lesion of the left parietal and temporal lobe, the dominant hemisphere, okay? The keyword for hemineglect syndrome is the patient will ignore his right side completely as it's not present at all, okay? So he will dress his only left side. He will comb his only left side of the hair, head hair. He will shave only the left side of his beard and ignoring the right side. And if you give the patient a photo like a clock photo, he will draw only the left half of it and ignoring the right half of this photo. This picture is very important in AMC exam. It's common in AMC exam. On the left, it's a patient normal without any problems, so he will see the clock completely. While on the right, the patient suffers from hemineglect syndrome, and the patient will see only half of the photo, not complete photo, okay? And also the same for the picture of the house that's present here. He will see only half of it, and with the flower also, okay? So only the patient will see half of it, one side of it, not complete, and this is hemineglect syndrome, and this picture is a keyword for it. While the keyword for gerstmann syndrome is dysgraphia, dyscalculia, which means difficult in mathematical calculation, finger agnosia, which means inability to recognize his own finger, and left-right disorientation, okay? This will represent the keyword for gerstmann syndrome, and it's very important. And the idea or the problem or the lesion of gerstmann syndrome is involving or lesion in the left parietal or temporal lobe, the dominant hemisphere, left dominant hemisphere. That's all. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.